Hello, and welcome to Talking Beyond Trauma. I appreciate an opportunity to be part of another MHTTC program, and this time, we asked the hard question. How do you get ready to support learning and growth for students and for yourself? Today, we explore the practice called mindful self-compassion. We look at what it is, what it isn't, and how it helps us all be better at seeing ourselves and others. For those of you who left us feedback asking for a school-specific session, we thank you. We heard you and hope this discussion broadens your scope and helps you add to your professional and your personal cup. In today's session, we will be talking with Dr. Natalie Fekosh. Dr. Fekosh is a mental health professional and educator. Her educational experience began as an elementary school teacher, reading interventionist, professional school counselor at both the elementary and secondary level, campus administrator, and district level administrator. She lives by the motto, "You can't pour from an empty cup," and aspires to promote self-care and self-compassion in all areas of her life. She is passionate about growing leaders as a certified Dare to Lead trainer. She's been trained by Dr. Brene Brown. Amongst many interesting conversations about workplace wellness, Natalie and I share a passion for and often discuss the need for increasing the capacity of school staff and administrators. Following up on her pour from an empty cup motto, we decided to meet formally to discuss tools to assist educators and other employees working in the school mental health arena. We have a great discussion lined up for you today. Let's see what Dr. Fekosh has to say about finding balance, being aware of ourselves, and how the two help us make connections and increase productivity in school. It's real talk with real people. Welcome to Talking Beyond Trauma. Well, good morning, everybody, again. My name is Mordecai Dixon. Welcome back to Talking Beyond Trauma. I am delighted again to continue a conversation that we had on mindful self-compassion. I'm here with my colleague, my bud, my close teammate, Dr. Natalie Fekosh, affectionately known to us as Natalie. So how are you today, Natalie? You want to tell folks who you are?
Sure. Hi, my name is Natalie Fekosh, and I'm happy to be here again.
Yes, we're glad to have you. It's been an interesting conversation. We started a conversation last time we spoke about a concept that for many may seem a little unattainable. It was tough for me to hear about this thing called mindfulness. And when you talked to us last time, you broke down a lot of this, and what I walked away with is, number one, this is not magic. That you can make this fit into the way that you see the world. So the tools that you use don't have to all be the same. This is not a one size fits all kind of thought process. That it really is important to building connections with other people. And your professional experience is out of the school environment. So the world isn't going to be a perfect place, all that to say, simply because I'm being mindful. But it does set the stage for me to be able to have real, genuine human interactions. Probably the last thing I took away from it was that there is a little awkwardness in the way we find that presence, that we can name things that are stressful and aren't ideal. And by present, we mean just in a good state, calm state, one that's not encumbered by the stresses of our lives. I'm looking forward to the next part of this because I still have some questions from the last time we spoke.
All right, I'm excited. Can I address something just really quickly as you were
Of course.
kind of summarizing our conversation about mindfulness? One thing that you said was, one of my takeaways was that being mindful is being calm. And actually, you can be mindful when you're not calm. That's not like a prerequisite. It's not a determiner of whether or not you're being mindful, or even potentially even an outcome. So you can be mindful and be in complete chaos.
That's
So
important
I
to
just
say.
wanted to kind of name that because I
Yeah.
think about the life of a professional educator. There are a lot of times in leading the classroom of students or a campus or a district where it's chaotic, and you can be mindful in that. It does not have to be a calm space. It's just being aware of where you are in the moment and recognizing what you're feeling and not judging the feelings.
Okay. So tell us a little bit more about that, not judging the feelings. Something tells me where we're going today is our tendency to judge those feelings. I'm harder on myself than I probably ever would be with you or members of our team, and definitely would not say things to my service recipients or my program participants that I would comfortably say to myself.
Oh, yeah.
So
We
um,
are not very nice to ourselves.
yeah,
Our
yeah.
brains are wired to do that. And that's actually a really nice lead into what self compassion is.
Hmm.
One of the three components of self compassion is how mindful we are versus how much we over identify what's happening. And so, mindfulness is knowing that we're suffering while we're suffering.
Mm.
This is a prerequisite for compassion to arise. Mindfulness allows us to turn toward painful feelings and be with them as they are. I guess another kind of example, mindfulness is a balanced state of awareness. We don't suppress or avoid what we're feeling, nor are we carried away by the dramatic storyline of what's happening. That is what we would call over identification. So, in order to be truly mindfully compassionate, we are just in a state of awareness. Sounds a little complicated, but basically, it's not suppressing what we're feeling, it's sitting with it and then offering ourselves some compassion in that moment.
Mm. I do want us to explore some of that now. The mindfulness is the catalyst. Without it, we know we can't get to compassionate places with each other and or with ourselves. Um, you mentioned self-awareness. Is our compassion connected to that awareness, or is it something separate and apart?
Awareness and self compassion are connected.
Mm-hmm.
Um, because I would define self awareness as being, aware of yourself, what your needs are, what your strengths, your areas for growth are. And self compassion is basically giving yourself what you need. Um, the definition of self compassion is simply compassion directed towards oneself, inner compassion. Um, Compassion could be defined as, and this is coming from Goetz, Keltner, and Simon Thomas. Compassion may be defined as the feeling that arises when witnessing another's suffering, and that motivates a subsequent desire to help. So, self compassion is recognizing it and noticing your own suffering and giving yourself what you need.
To suffer with is the compassion model that I learned under, so that I get that. I don't know how much time we've ever really spent with it, Natalie, if I'm being honest with you. I don't know that I spent a lot of time professionally focusing on it. I was supposed to focus on what I was doing so I can stay in a so-called empathetic or empathic response setting, but it was external. It very rarely came back home. It very rarely was about me. It was supposed to be about my client.
Right.
It was supposed to be about my program participants and whomever else we were calling them that day. So I say that because I think a lot of folks are just kind of coming into this new thought process of no, you really have to embrace where you're falling short,
Right.
no matter how good or bad that's making you feel, in order to help somebody else. That would have been great to know. That would have been some great learning. Had folks had just said that clearly once upon a time.
Yeah, I imagine. I wonder how like you and I's professional lives would be different today had we known that and practiced that when we were starting out. I wonder, and I am, yeah, it kind of leads me to think about um people who are just beginning their careers in their 20s and 30s, and uh
Mhm.
I wonder like what's their trajectory. Are we going to have more mentally balanced people? um I bet we will, and that's kind of my thought, which is exciting because I'm getting up there in age, and so yeah, it's just interesting to think about.
It's great to be able to also mentor around issues like this because, from a health perspective, I'm glad that you spoke about this from a health perspective. Physical health, as well as mental health, emotional wellness, are all kind of connected
Mm-hmm.
to this mindfulness, as well as connected to the way that we talk and treat each other. So if you've already dealing in environments where there's complex trauma, you're working with students, they bring their complex traumas to the table, and you're not able to name, process, and sit with your own feelings on some of this. Yeah, a 30-minute supervision just may not cut it in terms of your own wellness, which means you're coming to work every day unprepared. You may have your lesson plan. You may have all the tests ready. There, everything is scored for the month. You've written the parent memos, and oddly enough, you've left the most important piece at the front door. You didn't check in with yourself. Um, wow.
I would imagine that we all would agree, or at least know that it's important for us to take care of our physical health. We're supposed to, you know, go get our annual physical, get some blood work done, have our exams, whatever we need to do to make sure that we're physically well. Go to the dentist, maybe go get our eyes checked, go get our hearing checked. Um, but are we normalizing brain health? Um, And there was a push. I remember a few years ago reading some articles that there was a push where some people were trying to kind of destigmatize mental health and or mental wellness and use the term brain health as less stigmatizing. And so I wonder like um, what that might be like if everyone recognized that. My experience with a lot of people in my generation is that we don't do that. We don't talk about things that are bothering us, et cetera, et cetera. But um, I am excited because my boys are now in their 20s, and they're okay with talking about things that are going on in their brains, and they're which is a form of self-compassion, actually, right? So that really excites me. I think that's going to be really great for our future educators, future leaders who are leading school districts, who are making an impact in their classrooms, and they're raising children potentially. So yeah, I just wanted to mention the importance of making sure your brain is healthy too. And one way we can do that is by talking to someone about what's going on and what we're thinking. And I would definitely, if I was having a heart issue, go to a cardiologist, right? They're specially trained to take, they know about the intricacies of a heart, and they can help you with that. And if I was having any kind of brain issues, I don't want to say issue, but concerns about my thoughts and my feelings, well, I would definitely want to go to someone who specializes in that, like a psychologist, a psychiatrist, a therapist, an LPC, because that's what they're trained to do. Imagine. So I just want to mention that would be, like I said, another form of self-compassion is just recognizing that and normalizing that.
I like the concept of brain health. It aligns with physical health, and I think it's actually easier for people to digest than mental health. That said, I'm still taken with the sad reality that I can break my arm, and people would encourage me to go get medical help almost immediately. But if I'm feeling low, experiencing emotional crisis, or needing some long-term care, those same people are likely to tell me things like, it's all in your head, don't overthink it, just move on, or act and say things that communicate that my mental health is just a convenient tool to use when making excuses about my actions. Our mental health is as important as our physical health. Both influence our ability to be good for ourselves and others. There are industries, organizations outside of education that do push the envelope on making sure that their employees have access to counselors in real time, people who are licensed, who can provide emotional and mental health intervention, clinical intervention. I'm speaking specifically about. Those folks are almost pariah in those organizations, though, and that I think some of that comes from, like you said, this idea that we were, in essence, taught to tough everything out, and suffer meant suffer through, opposed to embrace suffering, name it, and find ways to process it. What we have in the other end are folks who unwittingly, this isn't about shame and blame, push the limits of their brain's ability to handle the stress that was coming at them, both in their personal lives as well in their professional lives. That would be an incredible shift in organizational culture for folks in disciplines, especially high stress. I'm thinking first responders of all kinds. I'm thinking nurses. I'm thinking law enforcement, public safety folks, EMTs, people who just see the most challenging of things happen. And I add teachers to that. And you see complex trauma in ways that most other professions don't.
Agree.
And so, yeah, you have to start paying attention to the fact that this is doing something to my brain. It it is having an impact on my ability to function.
There are a lot of school districts who have EAPs, which is an employee assistance program, where all staff who work in a school district, from operational to transportation to teachers, can receive free therapy. And it's confidential, of course. And I can tell you, like firsthand, when I did serve in the role of supporting counselors at the district level, I did spend a great deal of time supporting staff.
Yep.
Like not just the school counselors, but teachers and other staff in the school district who were having some mental health needs. And there are a lot of school districts who have hired licensed professional counselors specifically for the staff only. I know they do that in the healthcare industry. And so at least I've heard that. So I just want to plant that seed for anyone who wants to create a compassionate, trauma sensitive space to work.
I'm glad you did plant it. I'd like to add some water to it, since we're using the metaphor of growing a nice garden here. Increase the capacity by setting a norm, by wanting it to be for your employees. You can create it, but it has to, and then we have to do a lot of collaborating around that. I don't say that in isolation. I'm not saying it like a wish list. We really have to start building out the curricula. You're an educator. You train up new schools counselors. You tell them the ways to operate in that profession so that they can have success. I think we have to do that for all people who are going to be working with, or even minimally being exposed to folks with complex trauma experiences, which is almost everybody at this point. So to have LPCs on site, that's just a matter of allowing your innovation to come to life. Like, that's awesome.
Yeah.
But for every one school that's doing that, there's just as many, 3 to 4 more, that aren't, or don't see a value in it, which is really scary. We have a capacity issue, as we said in our first discussion. it's hard to be self-compassionate when your your teams are just walking out. They see their work as failure opposed to the successes of coming in every day and doing the hard work that they've been doing. So you're also wrestling with some of the dynamics that are happening in education, period.
Yeah.
um, I would think this is a great tool, being self-compassionate. We've talked about that. Let's talk about what some of it looks like. Now, we've been through some training together. I sat through some of that training. I'm going to say out loud, we keep it real with each other. I was not convinced when I walked into this training. I was like, okay, here we go. The pragmatic taskmaster in me just wasn't ready. And now I find myself using these tools, and I'm encouraged. I'm, they're not my bond. I'm not doing it as consistently as I probably should be, but I recognize that they're important, mostly because of Dr. Neff's work, your work, and the things that they're simple tools. I think they were simple tools. They weren't things that were so difficult that I needed to amass a whole new set of skills. All I had to do was try it.
Yeah. Thank you for your honesty. I would imagine there's a lot of people who feel that way. I think about this. I think about some trainings I've been able to provide in school districts, and I'll, submit a proposal with a title, and I'll get feedback. Can you change the title?
Can
Sometimes,
we call this something else?
uh, just the title of being mindful and well, kind of already can make some people uncomfortable. So just interesting thought. So
Yeah. Self-nurturing activities, just simple touch, any of these types of things, literally saying to yourself affirming things. um, we don't do that well, and some folks can't hear that. I want to also honor that, because of their experiences, some folks, their ability to digest a number of affirming messages is also, it's inconsistent with what maybe they were ever told in their lives. um, so to be now bombarded with this challenge to find positivity, and as you said before, not perfection, but getting to a place where you're being able to state out loud, this is what I need right now, this is what's going on with me right now. That's a level of vulnerability most of us just weren't taught. I could speak for myself culturally. It's not a level of vulnerability that I was socialized to demonstrate to anybody.
Yeah. I know what's pretty amazing about the human brain, though, is that we can create new neural pathways.
Okay, let's talk about that. I'm glad
do
that
different things.
let's talk about that.
I think one of my most favorite quotes is, "What fires together wires together." And so when we can put a practice in place, a mindful self-compassion practice as an example, the more you do it, the more likely it becomes a part of who you are and your DNA, I don't want to say DNA, but your brain chemistry, your brain structure. Also some research from Kristen Neff and Chris Germer, is that whenever you experience a mindful self-compassion moment, if you just hang out there for 20 seconds. So, for example, let's say I'm making the conscious choice to really be mindful and look out this window right now. And I'm just going to look at the colors. I'm going to look at the shapes. There's cattle walking. If I can just sit there for 20 seconds and just be in that moment, that's going to help those new neural pathways to develop. So it doesn't take long, right? It just takes practice, and it takes probably a little consistency.
I do know, without magic, right? Without out of body kind of experiences that just saying nurturing things to myself, sending a counter message to my self-talk helped.
Yeah.
It didn't fix, it didn't change my circumstance, but it did make me say, here's another way of looking at this. You could look at it as this glass half empty approach to life, or you can look at the reality that you're slowly adding to more than the half.
I like that.
So, I'm not filling it up. The glass isn't full. No, I'm not. That's just not who I am as a person. But the glass is not half empty either. There are some things there that you can continue to work on. So, really, really cool stuff in the end. I walked away from the instruction believing that this was missing in my professional development. I got a lot of great information from a lot of great people. I did not really embrace how to take care of me by being compassionate to myself. As I said before, I think the focus is more external. We're supposed to be compassionate to the people we're working with. And that equation just never will work if we're not starting with ourselves.
Absolutely. So important. So I really appreciate how Kristen Neff has kind of broken down self-compassion, mindful self-compassion into 3 different pieces. She actually also has created a self-compassion scale, which is an evidence-based assessment that you can take online to see how self-compassionate you are. What I really love about that scale is it doesn't take long, about 6 minutes tops, and it gives you a really nice report out of how self-compassionate you are. And then she's got some really nice exercises that you can find online that you can start to equip yourself with some tools and some resources, some mindfulness practices to help you be more self-compassionate. So what she does when she talks about self-compassion is she's divided into 3 components. And I want you to kind of visualize like these 2 terms on opposite sides of the spectrum. It's, are you self-kind? Are you self-judgy? So the opposite of kindness is judgment. Are you aware that what you're experiencing is part of the common human experience or common humanity? Or do you use that to isolate yourself and feel different or othered than other people? And then the 3rd component is mindfulness versus over-identification. So meaning when you're suffering, you recognize you're suffering, or do you over-identify what you're feeling and not stick with just recognizing that you're suffering? So again, 3 components: self-kindness versus self-judgment, common humanity versus isolation, and mindfulness versus over-identification. Someone who's truly very self-compassionate is kind to themselves, recognizing that what they're experiencing is part of the common human experience, and they're mindful.
Got it.
They're in the moment.
So, in other words, what's happening to me is not so unique that it only applies to me. This is just part of being a human.
Yeah. Yeah. And so to give you like a quick example of a recent time where I was feeling this way, had a difficult experience this week and dealing with another person. And if I was not being self-compassionate, I would have been very judgy of myself. Like, you should have handled that differently. Like, no one else would have handled it that way. Why did you say what you said? And I would have been really like over identifying kind of what I was feeling. Like, that was dumb. That was stupid. We need to go back and redo that conversation. But being someone who's working towards being more self-compassionate, the voice in my head was saying, wow, like you really just had a hard conversation, and you did really well in, reframing that other person's opinion. And a lot of people have hard conversations. It's part of working with humans. There are hard things that happen, and sometimes conflict happens. And then I was mindful because I was like, this hurts. Like my stomach is burning and my heart is racing. So I was I was being kind to myself, recognizing that this is part of being a human, and recognizing like the physical feelings I was having with that.
Thanks for sharing that. Now, there's two things that pop out for me as you say that. The first is being mindful doesn't mean we don't tell each other the truth. The truth is still the truth. You had a hard discussion
Right.
because you had a hard discussion. There was some conflict there because there was some genuine conflict there. I think sometimes folks hear this and they hear just the opposite, is that, no, I have to tell myself something positive about this. Which makes it aversive for some folks. It's like, no, you're denying, or you want to gloss over this content area. I think what I'm also hearing is that there's a challenge here, to allow yourself to get it wrong and still be okay with you.
Yeah.
Which
We
is
are
not,
perfectly
yeah,
imperfect.
like, because as you were saying, some of the things that you said wrong, I mean, that would be me for like 3 days. 3 days later, I would still be ruminating over, what I didn't say, how I should have said it, and all this other stuff. But if I'm being honest, I probably would also be avoiding the person. I would not want to go back into an uncomfortable situation. I may not have the words. This stuff applies across the board. So I like the common humanity pieces of it. I mean, you could do this with, and probably have to do this with, members of your family, especially with holidays and all the stuff coming. There's a lot of mindfulness that needs to take place in some systems, but also the person in the grocery, the person that you're working with, and your colleagues and your teammates. So this is powerful. These tools challenge us. What would be the order of preference for you? You mentioned a lot of tools, and I think sometimes people get overwhelmed when they here's the litany of things that are available to you. We'll make the resources available to folks, but I'm kind of curious about that mindful self-compassion survey or tool.
Yeah. I would say, after you hear this, wherever you are, spend some time over the next couple of days just noticing what your thoughts are, noticing when you're in certain situations, noticing what you're physically feeling, the stories you're telling yourself about things that are happening or even not happening. And if you feel intrigued, check out some of the resources. We'll have several resources that we'll post with this, but go to the Mindful Self-Compassion website. And if you feel so inclined, take the assessment. The data is not saved by them. It's just for you. And take a look at some of the practices that are available online. And if you're really intrigued, reach out to us and consider being a part of the training that we're going to have beginning in January.
Great resources from a great resource. Again, we shouldn't deny ourselves opportunities for wholeness, and this is not the only tool, but it definitely is a tool that can help us achieve wellness and well-being. Natalie, thank you so much for being on the program. Thank you for sharing your insights. When we come back, we'll tell you about how you can get some of those resources. We'll definitely set you up with all the information you need about upcoming training, tools, and any of the information that you've heard on the program today.
Thank you for tuning in to our production of Talking Beyond Trauma, which is made available by the South Southwest Mental Health Technology Transfer Center, or MHTTC, through a cooperative agreement funded by the Substance Abuse and Mental Health Services Administration, or SAMHSA. The MHTTC's primary goal is to provide free training, share best practices, and offer ongoing support and consultation to professionals serving individuals with mental health challenges. We would like to extend our gratitude to our guest, Dr. Natalie Feacock, and our host, Mordecai Dixon, for their contribution to this discussion. Lastly, we would like to acknowledge the hard work of our dedicated team, without whom this project would not have been possible. And thank you to Make Every Media for their partnership in the development of Season 1. Season 2 was produced by the communications team here at the Texas Institute for Excellence in Mental Health. It was recorded and edited by Mackenzie Bentley. Our theme music is by Scooter Holiday. The opinions expressed in this presentation are the views of our speakers and do not reflect the official position of the Department of Health and Human Services, or SAMHSA. If you'd like more information on this and other MHTTC products in the South-Southwest region, you can find a link in the episode description. This discussion was pre-recorded. We appreciate your participation and hope the discussion helped your journey. Be well.